Hello friends, and welcome back to Mechanistic Pharmacology once again. Friends, in today's part of lecture series, we are going to learn the third part, that is antiretroviral drugs. Friends, up till now we had learned the pathogenesis of AIDS, which refers to the terminal stage of infection caused by retrovirus. Along with it, in part 2 of our lecture series, we had learned about the structural component of human immunodeficiency virus. Friends, what we had learned up till now, that so far there will be no cure available for infection caused by HIV, but there are number of drugs which are available which slow the progression of HIV infection. So in today's lecture series of part 3, we are going to learn about different types of antiretroviral drugs along with their mechanism of action. So let's begin with the learning. Antiretroviral drugs. Friends, antiretroviral drugs, they are also called as anti-HIV drugs. So far, no cure is available against the HIV infection. Friends, these drugs can only limit or slow the progression of infection, and the treatment of such type of infection is always aimed at reducing the plasma viral load as much as possible. Friends, it should be started before the immune system is irreversibly damaged. And friends, there are number of drugs which are potential toxic as well as they are liable towards the resistance, that is called as drug resistance, and therefore they require an early multi-drug treatment for its therapy. So friends, multi-drug treatment is always preferred as per as the retroviral infection is there. And therefore friends, there are number of groups are available as anti-HIV drugs which are given in multiple combination for the antiretroviral therapy. So the categories include nucleoside reverse transcriptase inhibitors, example Zidovudine and number of drugs, then non-nucleoside reverse transcriptase inhibitor, example Nevirapine, nucleotide reverse transcriptase inhibitors, example Tenofovir, etc., protease inhibitor Ritonavir, then integrase inhibitor Raltegravir, Chemokine receptor 5 antagonist Maraviroc. Friends, as I already told you that multi-drug treatment required for the antiretroviral infection, and therefore highly active antiretroviral therapy is always preferred against the retroviral infection. So let's learn the individual categories of the drugs along with their mechanism of action one by one. Nucleoside reverse transcriptase inhibitors. Friends, drugs belongs to this category are competitive inhibitors of enzyme reverse transcriptase. Friends, these drugs, they compete with the natural pyrimidines or purines. Friends, Zidovudine was the first anti-HIV drugs to be introduced and is still most widely used along with other anti-HIV drugs. Friends, it is one of the prototype or thymidine analog, and it phosphorylate the cellular enzyme to its triphosphate metabolites which inhibit the enzyme reverse transcriptase, and therefore friends, it terminates the elongation of chain. Friends, this drug is 30% bound towards the plasma protein and get metabolized via liver through gluconidation. Friends, due to partial inhibition of cellular DNA polymerase, the biggest serious toxicity is bone marrow suppression, anemia or granulocytopenia. Along with it, there are other side effects which includes severe headache, then insomnia, along with vomiting. Friends, the other drugs includes are diadenosine, Zidovudine, Lamivudine, Gemcitabine and many more. Friends, this category is contraindicated in breastfeeding. Now, next category towards the retroviral infection is non-nucleoside reverse transcriptase inhibitor. Friends, these drugs they directly inhibit enzyme reverse transcriptase. They do not require the intracellular phosphorylation and therefore they directly inhibit this enzyme that is called as reverse transcriptase and thus inhibit the complementary DNA synthesis and therefore it terminates the elongation of chain. Friends, this is one of the potent drug which is required against the HIV infection. It get metabolized by cytochrome P450 3A4 isoenzyme to several hydroxylated metabolites. Friends, few side effects includes like skin rashes which includes edema, erythema nodosum or even Stevens-Johnson syndrome. Along with it, other side effects like insomnia, vomiting and headache followed by vertigo. Friends, other drugs belongs to this category are efavirenz, then delaviridine, then itravirine, lastly rilpivirine. Now, heading towards our next category, that is nucleotide reverse transcriptase inhibitors. Friends, the example of drugs belongs to this category is tenofovir. Dear students, due to less absorption of tenofovir, this is used as a disproxyl ester form which is a prodrug. It inhibits enzyme reverse transcriptase competitively and therefore it inhibits the complementary DNA synthesis and thus it terminates the elongation of chain. Friends, the advantage of such drugs is that along with the limit of HIV infection or viral load, this drug is also increases the CD4 count. In liver, via cellular kinase, it converts into its tenofovir diphosphate form which inhibits the enzyme reverse transcriptase. Few side effects includes like diarrhea, then depression or insomnia, vomiting as well as headache. Friends, this drug is an acyclic nucleotide and it is one of the analog of adenine which is also used against the hepatitis B virus infection and therefore it will prescribed against the HBV infection also. Now, coming towards the fourth category of antiretroviral drugs, that is protease inhibitors. The drug belong to this category is Ritonavir. Friends, these drugs they act on the later stage of viral replication where it inhibits the formation of new viral protein via competitive inhibition of enzyme protease. Friends, this enzyme is involved in breakdown of polyprotein into structural protein. Therefore, assembly of new infectious virions is prevented. Secondly, it also inhibits and affects the RNA genome formation of new virions, thus inhibit both newly formed cells along with the infected cells also. Other drugs includes towards this category are Indinavir, Ritonavir, Lopinavir, Nelfinavir, Atazanavir, Tipranavir, then Darunavir. Friends, these drugs, this category, they do not cure the HIV infection, but they reduces the viral load and therefore they slows down the disease progression. Few side effects includes like diarrhea, then drowsiness, vomiting or headache, and lastly tingling or numbness or burning sensation in hands or feet or area around mouth. Friends, recent findings indicates that protease inhibitors develop resistance against insulin due to increase in alpha amylase or maltase activities, and therefore hyperglycemia or type 2 diabetes may develop in patient using protease inhibitors. Now let's heading towards the summary of all these four categories. Dear students, up till now we had learned the mechanism of action along with their frequent side effects of all these four categories. Now, as we all know that the development of drug resistance is the biggest challenge as far as the antiretroviral therapy is concerned, and therefore for the suppression of viral load is best achieved by the combination of either two nucleoside analogues with non-nucleoside analogues or either with the protease inhibitors or nucleotide reverse transcriptase inhibitors. Friends, however, the choice of drugs based on different components clinically. In the next lecture, we are going to learn about the other categories like integrase inhibitor, chemokine core receptor 5 antagonist, along with the multi-drug treatment therapy or regimen against the HIV infection. So friends, these are few references which I had taken for the study. So stay tuned with the mechanistic pharmacology, and thanks for watching and loving mechanistic pharmacology by Dr. Nitin Nema. Thank you very much.